This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945. Hey everyone, welcome back to the Beat podcast, brought to you by Vive. That happened in Nashville, Tennessee. I'm so excited to be with the outstanding Harpaul Sambhi. He is the founder and CEO of Magical. His previous company's remarkable success led to its acquisition by LinkedIn in 2015, and he served as an advisor at On Deck, an entrepreneur in residence at Bain Capital Ventures, and has held various product management leadership position roles at Microsoft and LinkedIn, where he honed his expertise in innovation and strategy. I'm excited to have him here to talk to us about their work at Magical and how they're making a difference in the space. So Harpaul, thanks so much for joining us.
Thank you for having me, Saul.
Hey, look, always a pleasure. And to kick things off, talk to us about how your organization is helping to drive change in healthcare delivery. And let's just take advantage of this question to tell us a little bit more about the company and what you do.
Yeah, thank you. Magical, what we're all focused on is bringing AI employees to the workspace. So you think of the natural evolution that has happened in the last decade before ChatGPT kind of came onto the scene in 2022. AI has been around for multiple decades. However, it's been in the periphery of mainstream technology. And what we have seen in the last couple of years, especially with the rise of large language models or LLMs, think of ChatGPT, think of Gemini, is the fact that it's trained on the internet of data. And if you have such a vast amount of data, you can do some really interesting things with it, specifically around the tedious, soul-crushing tasks that people have. And when you zoom in on healthcare specifically, Magical has over 1 million users and almost 100,000 companies now. Our third largest segment is healthcare. We have over 150,000 users there. So we see a very unique vantage point. It is riddled with inefficiencies. You think of like the technology integrations, it's not there. We are connecting legacy HR systems with payer portals. We're doing a lot of long tail work, whether it's in revenue cycle, in the front of office. We're doing a lot of work to kind of copy or paste our way through workflows. And as a result, we're actually not really focusing on the patient. We're focusing on filling the respective information needed to ultimately get that paid by an insurer or payer. So we've seen, LLMs really kind of transform that. And what we've seen across all of our organizations, whether healthcare or not, is the precipice of being able to now clone yourself, Saul, to be able to do kind of the tedious work and do the things that you really love to do, right? We all go into healthcare for a specific mission, which is to provide really amazing care. Let's do that and double down on that versus kind of like a lot of the back office tedious work that we need to do.
Well, that's fantastic, Harpaul. And look, there's huge opportunities here. We all have seen the things that have come out in the last few years around, scribing for physicians or scanning documents for RCM. What do you see as the biggest opportunity for innovation in healthcare operations over the next few years?
Yeah, let's zoom in it for the next half decade, because if we look at the next half decade after 2030, I would say it's humanoids and robotics. However, I think in between 2025 and 2030, it's really around software enablement, and whether it's in the multimodal context of scribing, where it's taking audio to then translating it, or conversely text to then being able to go ahead and do specific workflows. I think it's really within software is where the vast majority of health systems and providers will see transformation occur. And I think agentic AI is really about two things. One is being adaptable, and number two is really about learning. Beyond just automating tasks, it's really about to predict challenges, optimizing the workflows, and supporting smarter decision making in real time. And an example here about being adaptable is we had Magical's AI employee. We have our own AI employees. It autonomously took an HFMA certification on its own and passed with flying colors. it was really cool to see, right? Like it logged in, it clicked on it, it started to learn kind of all the certification requirements and requisitions. It did its tests, it got certified effectively, and it started to consume and learn. And now we're able to use that agentic AI, then help with the scenarios that some of our customers might have when it comes to revenue cycle. And that's just one example, right? And however, if you contrast that to the rules-based tools like robotic processing automation, which struggle to keep up with today's complexity in the ever-changing landscape, it's night and day. And we've seen that whether it's with payers or EHRs that use our products for back office or providers, that agentic is just great at predicting challenges, at optimizing those workflows, and just supporting smarter decision-making processes and decisions in real time. So I think that's like we've seen that already occurring in revenue cycle with some of our customers that leverage us there. We've seen that in front office as well. With revenue cycle, we've seen them with reducing denials and cutting administrative costs altogether. And ultimately, that speeds up the reimbursements, and it then allows the provider to really focus and double down on patient care. Because that's what really matters.
I love that. I love the breakdown. Next 5 years, it's agentic AI, and then after that, humanoids and robots. I'm I'm excited for what's to come. So, with many saying that RPA is dead, what do you believe is driving RCM leaders in particular to adopt more advanced technologies like agentic AI?
Yeah, it's a greght question, Saul. So I'd like to pose a question to you in the audience. Remember the days when we used to print out directions or go to AAA or use
Totally.
MapQuest? How did that feel, by the way? Remember those days? Like, how did
I
that feel?
remember them. I mean, it felt normal. It was like what we were doing, right? I mean, it wasn't fun, but that's what
Yeah,
we had, right?
totally. I
Or
remember
MapQuest.
some.
Did you say MapQuest too? I remember MapQuest.
Exactly. It brings a smile to everyone, right? But it was just like piles of pages where mom and dad or we would have to like kind of traverse through.
Yeah.
But the interesting scenario about that analogy is when we took those directions, when we went onto the road, we then found ourselves stuck in a big roadblock. Remember that? Like it's
Yeah.
like bumper to bumper, or there was just like
Totally.
construction on the site, and then we're having to be left to our own devices to figure out how to go there. Naturally, what we did was we would go to a gas station, right? And we'd be like, how do we kind of go back to this new route or something? But that's effectively what robotic processing automation is. It's something that changes on your route, you're kind of stuck. And the vast majority of automation is kind of built on the rules-based engine. And that is like why there's now an adage of robotic processing automation, or RPA, is just ultimately dead, because they're gone are the days of the rule-based rigidity of these solutions, making it really ill-equipped to just handle the complexities of our modern healthcare operation. So we really need to create and support a complex decision-making tree and all the scenarios when the landscape is constantly changing. And the reality is no. RCM leaders specifically are now turning into and turning to more, advanced technologies like agentic AI, because again, it offers the adaptability, it adds the intelligence and scalability of it. And unlike the predecessor, which is automation that's rules-based or robotic process, it just doesn't execute repetitive tasks. Just it learns from the data, it predicts potential issues, and it's proactive. So it's able to understand that roadblock and go around it versus just being stuck and waiting for a human to kind of come and to unblock it or to like revamp it, so to speak. So I think that's like where the capabilities are occurring. And that analogy really poses it well. And in today's, which is super crucial in today's healthcare landscape, where leaders are super under pressure to do more with less. When you think of shrinking margins, the complexity with claims, and the cat and mouse game that's happening, and the rising administrative costs that are occurring, it's agentic AI is just not a tool. It's just a competitive landscape change and an advantage that I think everyone should be looking to adopt a piece of or altogether over a timeline.
Yeah, no, I think that's fantastic. And Harpaul, how should we be thinking about magical? There's a lot of businesses that were at the conference. Should we be thinking about magical as a white label partner, a platform that could be leveraged to help our customers? Talk to us about that.
Yeah, Magical specifically, we have three product offerings, and I kind of look at it as like a 2 by 2 matrix, right? One is, do you know your standard operating procedures, or SOPs, which is like the workflows that you have well defined? 90% of organization, including magical internally, and we don't have 100% of those well defined. Things constantly change, right? So when we onboard a new person, a new provider, a new RN, or someone in billing, we're constantly having to look at old documentation and rewrap it. So we have a product there, which is focusing on process mining, which takes 2 weeks and effectively starts to document what everyone is doing and how they're doing it in an anonymized way, but it gives you the playbook now to say, here are the 400 processes that you have in your company or your department. Which one do you want to use? So it's a playbook effectively to then say, okay, we want people to help revamp this. We can add more process here. But the long tail, which adds up quite a bit, is like where you can start to attack and create a lot of efficiency gain. So with that playbook in mind, we then have two product offerings. One is human assisted, which is basically enabling and empowering everyone to become Iron Man and women effectively. Or you can have agentic, which is completely kind of removing the person out of that tedious task and now allow agentic to do that. So that's how like we allow organizations to go on the journey of agentic because it's really sometimes daunting to know where to start. We kind of show that playbook, and within 2 weeks they have that playbook. And then within a week or two, they have the ability to launch into automations very quickly versus traditionally the months that typically take with automations.
That's awesome. Thanks for outlining that. So, a lot of people, a lot of organizations, a lot of boards, a lot of leaders are thinking about how do I implement this stuff? What advice would you give healthcare executives navigating operational challenges while trying to drive digital transformation?
Yeah, it's a great question. I think it falls down to three key principles. Number one, clarity. Number two, collaboration. And three, being adaptable. So, first, let's talk about clarity. It's like, what do you really want to achieve? Whether it was kind of doing a on-prem to cloud migration to now thinking about non-AI to AI, digital transformation isn't about adopting the latest technology for its own sake. It's really about solving the real problem and delivering the measurable result. So understanding what the KPIs are, you may or may not know where the problems lie. You just know that the problem exists. But I think having a true North Star to be able to say, this is where we want to go, this is how we want to transform ourselves, and now start understanding the who, what, when, it really starts to root ourselves on the clarity that then kind of allows you to go to number two, which is really kind of thinking about collaboration and collaboration across teams. These transformation is just not an IT initiative. Like I would say over 95% of our sales and our partnerships with healthcare organizations don't stem from the CIO. It's ultimately coming from the CMO, or it's coming from the CFO, or it's coming from someone in operations. And it's really the business stakeholder because what AI does is it allows you to either again empower your current workforce and or allow you to augment your current workforce, and that's not necessarily a technology initiative like IT. So I think it really requires input and alignment from clinical, operational, and technical stakeholders to really succeed. And then the final one is being adaptable. Healthcare is just rapidly changing. When you think about like the cat and mouse game that happens in revenue cycle where payers are constantly evolving, they're using agentic solutions on their end, and it's really requiring a lot of increased denials if documentation is not proper, or conversely not knowing the necessary changes either on the political or on the technology landscape. The solutions that we need to use need to be flexible enough to really address those tomorrow challenges. So I think this is where advanced technologies like agentic kind of really come into play. They're just not tools, but really enablers, and they're continuously learning and improving altogether. So I think that's like the three fundamentals: clarity, collaboration, and adaptability is where I would really kind of give in terms of advice to our customers and generally to the audience here. And just leading through transformation is super tough. I've done that when I sold my company to LinkedIn and Microsoft, specifically. But I think with those three principles in mind, execs can turn challenges into opportunities that have lasting impact.
No, it's a really good framework. Harpaul, really appreciate that. And how big is too big and how small is too small as far as folks that could work with you? There's provider practices to super large health systems, large payers to medium sized payers. There's the vendor side. Like, talk to us
Yeah.
about that.
Yeah. We support EHRs that have done several hundred million in revenue. We've supported payers. We've supported providers, whether they're the complex health systems to conversely the mom and pop shops overall. Generally what I've seen across like the agentic solutions that of our brothers and sisters that are selling, whether they're on the scribing side or conversely on, and specifically on the automation side, the more automations you get and you do, the more transactions you have, the better the scale ultimately comes and the ROI comes itself. So naturally, I've seen a lot of vendors selling to kind of like the 25 practice, provider practice or higher, and then it goes into like the healthcare system. But it ultimately comes down to the number of transactions because that's where, it's ultimately the question of like, do I hire someone or do I, whether it's hire or outsource, or conversely, do I use people on process or technology? So generally, yeah, we do have mom and pop shops that are therapists that are using our products. Those are more on the self-serve. In addition to that, when we do kind of like the full-blown agentic side, they typically kind of go into like the 25 or higher practices, provider practices, to those that are doing 750,000 trend authorizations a month. Like that's what we've seen in scale. So it's high scale to low
I love it.
to volume as well.
I love it. So there you go, folks. I just wanted to put that out there so that we know exactly who Harpaul and his team at Magical serve. The opportunity is there for you. It's within reach, and I think they're a great company to check out. So Harpaul, what closing thought would you give to folks as we wrap up today? And where's the best place for them to reach out to you and your company to learn more?
Yeah, I think it's really to learn more about magical.com. I think everyone can use a little bit of magic these days, and we're happy to provide that to each and every one, whether it's with good humor or conversely partnering together. In terms of advice, I always come back to first principles, right? Whether it was, working at world-class companies like LinkedIn or Microsoft, or conversely partnering with our customers, it's really about thinking about patient care, really reading about that. I know sometimes we can get lost in the theme of how to think about, optimizing things and being riddled in kind of like denials over and over again. And just then as a result, we don't solve the systematic problem. We just add more people and process, and really kind of like looking at things 360, identifying, with clarity, kind of where people should be going after. I think the clarity, collaboration, and adaptability, that's what I've been taught by some really amazing CEOs in the past. And that's kind of like my parting thought.
That's awesome, man. Great way to conclude our time together here. Ladies and gentlemen, thanks for tuning in to the Beat podcast here with Harpaul Sambhi. He's the founder and CEO at Magical. Really privileged to have had him here on the podcast. And you'll see in the show notes all the ways to get in touch with him, the short notes on the things that he shared today. And Harpaul, thanks for being with us.
Thank you for having me. Pleasure.
This podcast is produced by Outcomes Rocket, your healthcare exclusive digital marketing agency. Outcomes Rocket exists to help healthcare organizations like yours to maximize their impact and accelerate growth. Visit outcomesrocket.com or text us at 312-224-9945.